Hi, and welcome back to David Pattinson's Accused Friends. Today I want to talk to you about the NHS propaganda that's infusing the airwaves and the mass media during the current health crisis. And people are saying, well, come on, David, we've got a health crisis here. What's wrong with thanking our great NHS? It's a national treasure. It's part of the crown jewels. And it's really, the crisis is used as a vehicle for propping up the NHS, and we use the thanking of the staff as a sort of a political tool to protect the NHS, which has ulterior political motives. And that's kind of what I want to talk to you about in this video. So what we have in the news are things like the clapathons and the medals for NHS staff, and there's no doubt that if there's a health crisis going on and there's a high risk of infection and death, then the NHS workers are doing the God's work for sure. But of course, we focus our gratitude and thanks specifically on the NHS when we have private medicine, private medical professionals, charity medical establishments in the country. We also have a lot of carers that look after their spouse or an unwell relative. And, why are we not thanking all of them at the same time? Why are we specifically just thanking the NHS? And, the reason is that the NHS is a political tool of government. It's used to prop up and it's part of the power structure of government. I don't think there's been an election since I started breathing where the NHS hasn't been, at the forefront of the campaign. And it's one party saying, the opposition are going to take away your NHS or take away your healthcare. The other party is promising to invest more than the other party. And the NHS now is it's the biggest organisation in Europe. I think it's about 300 billion a year we spend on healthcare. And what the government wants to do at all times is to get rid of any dissenting voices like I'm doing in this video. We don't want any dissent or debate about the NHS. We just want the British people to take it as read that it's a great thing. And of course, the big promise of the NHS is, look, if you pay your taxes, if you're a good citizen, even if you're not a taxpayer, when you're ill, the NHS will be there for you. And of course, I think what this health crisis has exposed is that when there's just a mass of ill people in the country all at one go, the NHS won't be there for all of you just because of, just the infrastructure is not big enough to cope with the entire country getting ill at the same time. And this is what theoretically would create a debate over, well, is the NHS, the best use of our resources? Is it worth people having a backup plan if the NHS isn't there for you, like a health savings account or a health insurance, just because, in a doomsday scenario, like a pandemic, we need a backup option to protect us in our hour of need. And that's a debate the government does not want to have. If this video makes it into Downing Street, they're not going to be sitting around saying, David's got a great idea. Let's schedule an NHS debate for September 15th. That's not what's going to happen. They don't want a debate on the NHS. They want to have the NHS as the sole monopoly in healthcare. And, they want to have a propaganda bit, what the government do. They want to have propaganda through the media telling you, the people, that the NHS is the greatest thing since sliced bread. Whether it is or isn't is immaterial. I mean, I was looking at some stats of the winter of 2017 and 2018, where the NHS, gave elderly people the wrong vaccination, and a lot of them died from flu. We had sort of 15,000 people dying from virus through that winter, which is only 3 years ago. We had about 50,000 excess winter deaths, and there was very little media about it. There certainly wasn't a lockdown or a national shutdown over 50,000 deaths. And but of course, we do now have a shutdown over 500 deaths a day, and whether that'll get up to the 50,000 number remains to be seen. So I remember back in the 1990s when I was a sort of a younger boy back then, and and Tony Blair used to talk about the great NHS being free at the point of use. And it was obviously a sleight of hand if you think about it logically, because if the doctor's getting paid and the taxpayer patient is paying their taxes, then how is it free? I mean, it's not free. It's the taxpayers paying the doctor through their taxes, and the doctor's providing the medical service. Of course, if you're not a taxpayer, then it's free for you, the non-tax-paying patient, but the doctor's still collecting money from a taxpayer. Maybe it's a healthy taxpayer that's paying their tax for an unwell, non-tax-paying patient at that time, with the promise that when that healthy taxpayer becomes ill, then they can get their NHS treatment. And what this does, from my point of view, regardless of the political implications, is we never really talk about the disincentive for healthy living. If people are getting free at the point of use healthcare, and I'm only referring to the non-taxpayers there, what is their incentive to be healthy? Because there's no financial penalty for not being healthy. And, the NHS originated from the Second World War and protecting poor people, giving them, a healthcare option, and it's morphed into, a massive monopoly organisation. And, instead of having the small number of poor people like we had back then, we now have, 40 to 50% of the population that are quote unquote poor and welfare dependent. And of course, the NHS becomes a massive political tool that the government can kind of dangle in front of them and say, vote for us or you'll lose your healthcare. And people say, well, we don't want to lose our healthcare. We can't afford anything else because we're so poor. So let's vote in the existing government and maintain the status quo. So what we've learned, I think, through this crisis is that we used to think that the NHS would cost us our taxes or the healthcare proportion of our taxes. And there's also a big opportunity cost for the NHS, because that 300 billion, if it wasn't spent on NHS, it would be invested into the economy. It would create more jobs for people that don't have them. It would pay higher salaries for people that do have jobs. And then that excess wealth could be used by individuals to spend on healthcare as and when they need it, and they could buy health insurance, or they could just pay the doctor when they need to go. And of course, they would have more money if they are not sick. Whereas the public system, it's you pay anyway, regardless if you're sick or not. So you might as well be sick, and then you're getting more value for money that way. So what we've also learned, so we knew about taxes, we knew about opportunity cost. But now we know that the NHS actually can cost us our civil liberties. Part of this government shutdown or lockdown is to do with protecting the NHS. If you're going to have 20,000 deaths from a virus like we're having now, do we want to have those 20,000 deaths in 20 days? Or do we want to have them over 200 days? So we shut down the country to slow the spread, or protect the NHS. We might not actually end up with fewer deaths, but what we're saying to people now is that, David, now that we've got this lockdown, you can have your NHS when you need it, because we're slowing the spread, we're delaying the speed of people coming into the hospitals, but, it may cost you your job, your company may go bankrupt, but at least you'll get your healthcare when you need it. And I think for the British people, we need to really ask the question of is this the right system for us? And unfortunately, as the government gets so big, freedom of speech, gets stifled, dissent gets stifled massively. I think this is a question that's going to be, something we're going to be waiting for a long time to really have an open discussion about as a country, because the government's not going to want to do it. NHS has a lot of political supporters from the poor, the welfare dependent group of people, and obviously with the recession caused by the shutdown, there's going to be a lot more welfare dependent people. There's going to be a lot more unemployed people, and they're going to see the NHS as a sort of a free benefit rather than, a net cost. And so that was really the point of making this video, to ask these questions that no one's going to be asked, or no one else is going to be asking, because we're drowning out NHS dissent through NHS propaganda. And, I actually think it's a pretty sad state of affairs. I've been, if we flip it around, we say that healthcare is a human right, but we never say that food is a human right. And you think, well, food, like we need food every day to survive. But the reason food's not a human right is because it's produced by the private sector. I mean, we have a terrific success rate at food provision in this country. We have 100% of food needs produced by sort of 1 or 2% of the population. And if you think back to the Middle Ages, where you had, thousands and thousands of people working in the fields, producing our food needs were produced by a much greater percentage of the population back then, whereas nowadays with mechanization and food technology and refrigeration, we're able to produce, massive amounts of food, far more than we need really. And you've seen through this crisis, I mean, I've certainly seen where I live, the supermarkets have been open, they've been fully stocked, more or less. And, it's been easy to go in, get food, come out. A lot of British people have stockpiled up on food, which is smart. And I'm sure that the food producers and the food logistics people in our country, all of these great people are making lots of money. I hope that they are, because there's a huge amount of demand. But, politically, we're never going to lionize our food logistics people or our food production people. We're never going to call Sainsbury's, the crown jewel of our country. But, the NHS, on the other hand, we do. So I hope this video has given some people, some ideas and some maybe new perspectives that they perhaps hadn't thought about before. This isn't a debate that you're going to see on Sky News or certainly not on the BBC. It's not one the government's going to want to have. They just want to stifle this kind of discussion. So I hope this video makes it to as many people as possible. And, there'll be plenty more NHS propaganda to follow on your television. I'm sure if you switch it on right now, you'll probably see it there in a short space of time. So thanks again for watching David Pattinson's Accused Friends. Please subscribe to the channel, and we'll talk to you soon.